Now, moving on to the next section, I would invite Dr. Rajiv Lochan, who is one of the senior most cardiologists, interventional cardiologist of India, then moved to Middle East, and I am sure he must be the senior most interventional cardiologist of UAE as well. He's been a wonderful teacher, a real good academician, also a researcher. He has a very novel and ideas, and he has an out-of-box thinking. He's very good in his skills. And I was impressed in interventional cardiology and vascular work. Even when I was a fellow and I was doing my DM, I used to see him operating, and we also see him speaking in the meetings, always with a new thought, and a thought which actually came in a lot of, at least 2 decades later. I remember one of his case, putting, multi-layered, putting 2 wall stents in aortic aneurysms and putting in coils, and that actually later on was the concept which the world accepted in multi-layer flow modulators. So let me ask him to chair this session and carry on with the proceedings. I would also request Dr. Omar Halak. He was traveling to United States. I don't know whether he has joined in. Dr. Brijesh Mittal, who also is a very dear colleague and works in UAE. He heads a department and a hospital there. Dr. Ajay Kanodia, again from UAE. Dr. Sachin Upadhyaya, who's been a very close and a very fond colleague of mine, and he's been instrumental in starting APVIC right from this place. From the first APVIC, he was there. And Dr. Abdul Rauf Malik, who was also my associate and a very good cardiologist and a good researcher who's also practicing in UAE. So I'll hand it over to you, Dr. Rajiv Lochan, and I know you have a talk, the first talk on ultrasound-assisted thrombolytic therapy in high-risk pulmonary embolism, and you are using some real new novel devices which we do not have in India. And it will be followed by a talk of Dr. Brijesh Mittal on aggressive therapy for secondary prevention of atherosclerotic cardiovascular disease, and Dr. Ajay Kanodia and Dr. Rauf Malik on update on NOACs and VTE. So I'll hand it over to you, Dr. Lochan, and for you to carry on the proceedings of this session.
Thank you, Dr. Khanna. And I think I'm so impressed that you remember that case, which was done about 25 years ago. And if I remember correctly, Brijesh Mittal was with me in Apollo Hospital when we did this case. And it has been a really innovative journey of the new procedures we have done. And many times it has been a question whether it was safe to do it. It's the only thing, that question I asked, whether it is safe for the patient, and only then we tried new therapies when they were not very established.